with respiratory, with pneumonia. Easy? What is called? What's this called in scientific way? What's called? Patient coming from home with pneumonia. With fever. Finish. This first category. Patient coming from home in ER, has cough, has respiratory symptoms. I do X-ray chest for him, or I hear bronchi on the chest, so I diagnose this pneumonia either radiological or clinical. Okay? I cannot use the X-ray. I can hear by stethoscope bronchi meaning pneumonia. Fever plus community acquired pneumonia. Finish? Number one. Number two, patient was in the hospital, admitted for any other reason, like appendicitis. You do appendicitis. He did appendicitis. Not do. He did appendicitis after 3-4 days. Patient was with complicated operation, whatever, with aspirated pneumonia and from anesthesia, whatever happened, and this patient, we discovered that he has pneumonia. This is called healthcare associated or acquired pneumonia. Yeah, he came from home without pneumonia. After staying in the hospital, he has pneumonia. This meaning healthcare associated pneumonia. Did the doctor, doctor in ER will discover this case?
No.
We should admit it into hospital. Unless the patient came to ER and say, I was admitted in King Khaled for the last 3 days, and now I have cough, we do X-ray and discover pneumonia. Okay? Clear?
Yes.
Number one,
Community acquired.
with fever. Fever cannot be present in some situation, like immunocompromised patient, sometimes coming with pneumonia without fever. Okay? So if the patient known with comorbidity, with or renal dialysis as example, or making transplant, renal transplant, kidney transplant, and he is on immunosuppressive medication, and he came with pneumonia without fever, I can suspect. But I don't like you to go more details. It's fever and community acquired pneumonia, or fever and healthcare associated pneumonia. This category 1, category 2 of suspected. Third category of patient is number 3 in the category. So if you make like this, he has 3 characters. Category 3 has 3 characters. Fever more than 38. Okay, number 1. Number 2, any acute illness. You can't tell anything. You can't tell acute gastroenteritis without respiratory even symptoms, or with respiratory symptoms, or sometimes many patient was confirmed he just complaining of acute severe body ache with fever. No any respiratory sometimes, acute severe body ache. Okay? So this category of patient has 3 characters. Number 1, fever more than
38.
Number 2, acute illness. Leave it acute illness. With respiratory symptoms or without respiratory symptoms. Number 3,
Severe body pain.
number 3,
Severe.
unexplained, meaning it was not with the patient before, not known to be. What unexplained? What thrombocytopenia and leukopenia. Okay? Okay? Leukocytic count less than 3.5 thousand and platelets count less than 150,000. Okay? Category number 3 has 3 characters: fever, any acute illness, unexplained thrombocytopenia and leukopenia. So, if patient came to ER with severe respiratory illness, high-grade fever, coughing, expectoration, I do X-ray chest, so okay, no pneumonia, but I am doubt of this patient. He looks very ill. I must take CBC and see. if he has both thrombocytopenia and leukopenia, okay, within this limit, 3.5 less for leukocytic count or for platelets 150 or less, I will consider this patient as suspected case. Okay? Usually this type of patient coming to ER with pneumonia. Pneumonia is okay. Pneumonia is so easy to discover clinically or radiologically. But when the symptom is severe, you do CBC and C. If you have thrombocytopenia and leukopenia. Okay? With the respiratory symptoms and fever to be category number 3. So we have 3 categories of patients up till now. Number 4. Who number 4? Who? Healthcare worker. Category number 4. Healthcare worker or people who are in close contact to confirmed patient at home or at hospital. Okay? A contact with confirmed or probable. I will tell you probable, but only concentrating confirmed. People who are in contact with confirmed case of MERS-CoV virus, including healthcare workers, we are all contact to the patient. Okay? And this person, what he have? He have upper or lower respiratory tract infection symptoms and signs within 2 weeks, exactly 14 days. Within 2 weeks from last exposure. Okay? Example. This my patient here is confirmed case of MERS-CoV virus in negative pressure room. I go to anti-room. I wearing complete PPE protective. Okay? Now I am supposing protective. I enter to the room, I examine the patient. Then I left the room, write my notes, and go. Okay? After 2 hours, the patient expired. This day I go to the patient, just consider my last exposure to the patient. Even if I am following this patient for 5 days. I will calculate from the day of last exposure 14 days. If I have any symptoms regarding upper or lower respiratory tract infection, that I mean I am suspected case.